Hey guys, Dr. Norris here from Koru Chiropractic, and we are at F45 today, and I'm going to be going over some basic spinal hygiene, some ranges of motion that you should be doing with your neck every single day. So just like brushing and flossing, there's certain motions in your neck that a lot of times, we're not getting to, right? You don't want to get all that gunk, you don't want to get all that buildup in your teeth. Well, you want to make sure your spine can move in the right direction so you don't get things like decay and degeneration, aka arthritis, okay? So it's a great way that you don't have to see me as often, or you can get even better results with the chiropractic adjustments that you're getting, all right? So my lovely wife and model, Amy here, is going to be showing us some of these ranges of motion. And the first one is called flexion extension, or simply looking up and looking down. So what you want to do is, you can do these in the morning, you can do them at night, you can do them several times throughout the day. But looking up and down in just a really isolated movement, and what you want to do is you want to do it about 10 times each. And when you do it after the 10th time, I want you to hold it at the end of the motion for 10 seconds. So when you get to the bottom, your chin should be tucking down and touching your chest. Now if at first it doesn't touch, that's okay, but what you'll notice is over time it should get easier and easier to do these motions. And when you look back, one thing you want to make sure you're doing is not arching in the low back. It should all be motion in the neck and no hip swivel or anything like that going on, okay? Now, as a disclaimer, if you're getting any pain, if you're getting any dizziness or blurred vision, stop these exercises immediately. Consult your doctor. But otherwise, you should be doing these things every single day, okay? Great. Now the next one is going to be rotation. So simply looking left and looking right. You want to get right to the point where you feel the tension, you feel like you can't look any further, but what you don't need to do is crank your neck one direction or another, okay? This is just about the active ranges of motion. This is what you can physically do with the muscles. Excellent. And then when you get to the side, you want to hold it there for about 10 seconds. You should really be feeling that strain and pull through the neck, but again, it shouldn't be painful. And then the last one you're going to do is lateral bending or lateral flexion, and that's going to be tucking your ear to the shoulder there. Now, one way this can be done incorrectly is when you bend to the opposite side, you let this shoulder come up. This is the shoulder you actually want to keep down, because that's going to allow you to feel that strain pretty much from your ear right to your shoulder tip, okay? So again, 10 each direction, and then when you get to the end, after the 10th set, you're going to hold there for about 10 seconds, okay? Excellent. All right, so make sure, guys, you're doing those every single day, even a couple times a day, especially if you're sitting, all right? When you're sitting, typically you get stuck in these positions for long periods of time, and that's just simply not healthy for the discs in your spine, okay? So to keep a healthy spine, healthy discs, healthy bones, healthy nerves, do these exercises every day, and you won't have to see a chiropractor as often, and when you do, you'll just get better and better results. So click the button below, subscribe to our channel. You can learn more about how to keep your spine healthy. And also check out our website below, because we can learn more about what Koru Chiropractic does, how we benefit people with neurologically based care, and how we get people back to their optimal function. Thanks, guys.